Hello everyone. This presentation will be on development, developmental milestones, and the assessment of development. The bulk of the slides have been made by the Indian Academy of Pediatricians and is available online as a part of the 2015 teaching modules. I've included a few extra slides in between taken from OPGuy's textbook of pediatrics, as well as including a few updates on other scales for assessing development and a recent update with regard to joint developmental surveillance along with immunization. Coming to the developmental rules, we know that development is a continuous process which begins in utero and progresses until maturity. It is a continuous process. The sequence of attaining all milestones is effectively the same in all children. It only varies with regard to the time and the manner of attainment. And all development proceeds in a cephalocaudal direction where head control precedes trunk control preceding limb control. So these are the three fundamental rules which remains the same. Development is continuous. The sequence is the same and it progresses cephalocaudally. Within the limbs, the control of the limbs occurs in a proximo-distal fashion where hand use is learned before finger control, and certain primitive reflexes must be lost before the appropriate milestone is achieved. Initially, a mass activity is gradually replaced by a more specific activity. Best example for that is when a bright toy is shown to a 3-year-old, he moves all the 4 limbs, whereas a 4-year-old or a 5-year-old will smile and ask for it. So the response is accordingly mitigated. Now, the primitive reflexes which are lost, which I mentioned have to be lost before attaining a new milestone. Some of these reflexes include the palmar grasp, which appears at 28 weeks and disappears by 2 to 3 months. Rooting reflex, which appears at 32 weeks and is less prominent after 1 month. Morose reflex, which appears at 28 to 32 weeks and disappears at 5 to 6 months. The asymmetric tonic neck reflex, which appears at 35th week and disappears by 3rd month. Landau reflex, which appears at 3 months, disappears at 1 year, and the parachute reflex, which appears at 6 to 9 months, remaining throughout life. Now, the asymmetric tonic neck reflex is also called as the fencing reflex. Fencing reflex, as you can see by the posture of the child, which is maintained in this slide. This is characteristically used to distinguish between a preterm and a term neonate at birth. It's one of the neonatal reflexes which can help us in predicting the gestational age. This appears by 35th week of gestation. Now, coming to morose reflex, it's also called as the startled response. If the child is initially held upright with this manner, without the head lag, and a brief sudden jerk is given such that the head loss is maintained, there is a startled response and the child begins to cry and attempts to regain its posture. This is the morose reflex. Grasp reflex is where if you keep a large finger within the palmar surface of the neonate, it tends to override that and form a grasp over that finger. Rooting reflex is often used to establish feeding. It often disappears by the 1st month. So if you take any finger and gently stroke the angle of the mouth, the baby turns towards that mouth and begins to start rooting over that, hence the name rooting reflex. Now, coming to development per se, we can classify it under 4 headings broadly, including a 5th heading of vision as well as hearing as well, because that too is important for development. The domains in which we assess development include gross motor, fine motor, social, and language, apart from which there is also visual milestones and hearing milestones as well. We'll explain each of these in detail. Now, coming to gross motor milestones, this is an additional table which I've included from the textbook OPGuy. A simple way of looking at it is, at each age, a particular milestone is expected and a child is expected to do something new every month. With every growth, there is expected to be a new milestone which is attained. So with that introduction, by 3rd month we can expect neck holding. By 5th month the child will roll over. So once the neck is held, child attempts to roll over. Once the child is able to roll over, the child tries to sit in a tripod fashion by 6th month. At the 8th month, the child sits with support. So initially, child is sitting in a tripod fashion, that is with support at 6th month. By 8th month, child sits without support. So from with support, child moves to sitting without support. At the 9th month, the child is able to stand with support. And by 1 year, child is able to stand without support. This milestone is particularly important because the first birthday milestone of gross motor is standing without support. By 15 months, a child is able to walk alone and is able to creep upstairs. By 18 months, a child is able to run. By 2 years, a child is able to walk up and down the stairs with 2 feet per step. By age 3 years, a child is able to ride a tricycle. It's easy to remember that, 3 for 3, 3 for tricycle. And by 4 years, a child is able to hop on one foot and alternate the feet between the steps. So the first image what I've shown is child sitting with support in tripod fashion by 6 months. Child sitting without support by 9 months. The creep position. Standing independently at 12 months. And able to walk upstairs and downstairs as shown in this image side by side. So a simple way of recollecting is a newborn does not have neck holding, so neck holding should be the first one that comes, followed by which a child is able to sit with support, without support, stand with support, stand without support, subsequently walk, run and hop. In that sequence you can recollect all the milestones at the appropriate age. Now coming to fine motor development, fine motor is effectively the fine movements of the fingers and the arms. So gross motor is more of a skeletal maturity and fine motor is more of muscle involvement and CNS maturity. So by 4th month there is a bidextrous reach. By bidextrous reach I mean the child appears to reach for an object with both hands. 6th month you will get a unidextrous reach where the child tends to reach for the object with a single hand. An immature pincer grasp is formed by 9th month, a mature pincer grasp by 1 year. By 15 months the child is able to imitate scribbling and can build a block of 2 towers. By 18 months the child is able to scribble and make a tower of 3 blocks. By 2 years the tower increases in size up to 6 blocks, and by 2 years the child can draw a circle. By 3 years the circle gets completed. Like I was saying, at 2 years it is a circular stroke but the circle will be incomplete. By 3 years the child can complete the circle. By 4th year the child can copy a cross, and by the 5th year a triangle. Now a simple way of recollecting that is, by 2 years a circular stroke develops, but a complete circle is not formed until 3 years of age. A little bit more of practice, that can become a square or a rectangle in the same motion, and that is at 4, and a triangle appears by the 5th year of age. I'm emphasizing upon this here. The copy the cross is one aspect at 4 years. So while you do get the cross, you also do get the square or the rectangle, both of which are the fine motor milestone at age 4. Now coming to the pictures, you can see a bidextrous grasp towards a dangling ring here in this image at 4th month. An intermediate grasp at 8 months, as you can see in this image. The grasp is not fully formed but some grasp is maintained. This is a mature pincer grasp, and you can note the use of the thumb. When I say mature, the use of the thumb is essential to call it a mature grasp. This is an immature pincer grasp where it involves the use of the entire palm as a whole. And another pincer grasp used for small objects such as raisins. You can see the child scribbling spontaneously, which corresponds to 15 months. And a cube of almost, a tower of almost 4 to 5 cubes here, which corresponds to roughly 2 years of age. And coming to the shapes, what we were discussing, a circle by 3 years, a cross by 4 years, a square or a rectangle by 4.5 years, a 5th year will give you a triangle, by 6th year a square with multiple triangles within it, by 7 years a diamond, by 8 years a multiple figured polygon, a cylinder by 9 years, and a cube by 11 years. Now coming to merely the blocks as a whole, by 15 months you can expect a tower of 2 blocks, that will become 3 blocks by 18 months, It will form a train by 2 years. So a child does have the concept of a train where the blocks are stacked one beside the other, as you can see in this image. So the train formation happens by 2 years. By 2.5 years, it forms a train with a chimney. So that extra additional concept of seeing and learning is maintained. And by 4 years, a bridge where 2 blocks and then a third block is balanced in between that. A bridge with a gate can be seen by 5th year, and steps are formed by 6 years. And it's important to note that the tower of 9 blocks is effectively formed by 3 years, where that sense of balance and perception is maintained in the child. Now, coming to the social and adaptive milestones, 2 months is what we call a social smile. By social smile, that child will smile at whomever he sees. Whomever he or she sees, the child will smile at that. By 3rd month, there is mother recognition and anticipating of feeds. And by 6th month, there is stranger anxiety. So apart from the recognized faces who take care of the child will feel apprehensive to see a new face. So it is effectively the exact opposite of a social smile. Both are exact opposites of each other. By 9 months, the child is able to wave bye-bye. And by 1st year, the child comes when called and plays simple games. Jargon speech begins by 15th month. And by 18th month, that is 1.5 years, the child attempts to copy whatever the parents do in day-to-day task. It could be cooking, it could be attempting to play with the phone, etc. By 2nd year of life, the child asks for food, drinks, and is able to recognize a requirement for toilet and pulls people to show for certain toys. By 3rd year, the child knows his or her full name and gender and is in a position to share toys with others. By 4th year, the child is able to play cooperatively in a group. Now, this is a milestone of controversy. Some do say this occurs by 3 year, but it is well accepted that it is at 4th year to play cooperatively in a group. And by 5th year is able to dress or undress on his or her own with other household tasks. So the first image, what you can see is recognition of the mother by the 1st month, showing intent regard at the mother's face as she is talking to the child. The 2nd image shows a social smile. And as you can see similarly in the 3rd image as well. Now, coming to language milestones, by the 1st month, the child is able to be alert to sound. By the 3rd month, the child starts to cooing and babbling also begins. A loud laugh appears by the 4th month, followed by which there is monosyllables at 6th month. By monosyllables, I mean it could be as simple as ma, pa, ba. Monosyllables. When I say bisyllables at 9 months, I am referring to amma, appa, papa. These are all bisyllable words which do appear by 9 months of age. By 1 year, the child will have a vocabulary of only 1 to 2 words but will have meaning. By 18 months, the vocabulary will improve to 8 to 10 words, but the child will still continue to speak in words and not sentences. Sentence formation begins at 2nd year of age. So the sentences will of course be of small with 2 to 3 words only. By 3rd year, the child tends to ask what questions, why questions, and also knows his or her full name and gender. By 4 years, a child is able to sing a song or a poem and tell stories. And by 5th year, asks the meaning of new words what he or she listens to. Now, if we consider the development age-wise and just go in sequential order, there is something what we call as a pull-to-sit maneuver, and up to 6 weeks where partial head control begins. So if you attempt to make the child to sit up, there will be a complete head lag. And another way of looking at it is called ventral suspension, where if you leave the head of the neonate down for just a split second, the head will maintain in a horizontal plane before dipping. So there is no head lag and there is no head control, but at the same time there is an attempt maintained to maintain that ventral suspension. So this is what you see in head lag. The photo demonstrates the procedure. In newborns, the head lags completely behind, and this occurs when the infant is gently pulled into a sitting position from lying down. So while the torso of the baby will come forward, the head will remain back in the lagging position. Similarly, as you can see in this is the pull to sit maneuver, where you enable the child to sit up. Now coming to the development at 8 weeks, in the prone position, the face will be somewhat lifted towards 45 degree and ventral suspension is maintained with the head in line, and social smile occurs by 8th week of life. That is what is seen in this image. Subsequently, at 4 months, if you see, when the same child grows up, a pull to sit maneuver will show the head is steady, and in a prone position, the face, head and chest is lifted off the pouch, whereas the rest of the body remains in contact with the ground. So you can see here, this portion is in contact and this portion is lifted. On fine motor development, there will be a bidextrous approach by this 4th month of age, as demonstrated in this image where the child is holding on to his toy truck with 2 hands. Now, moving on, by 6th month, the child is able to sit with support in a tripod posture, and there is a crude grasp upon a cube. Now, if this child is able to lift his or her chin with the greater part of the chest, and very minimal weight bearing is there on the extended arms. Now, as you can see in this image, at 8th month, the child is able to sit without support and is able to grasp objects by the radial aspect of the hand. At 9th month, the child is able to stand with support. The same child whom you saw here sitting without support is able to stand with support with immature pincer grasp and is able to wave bye-bye, speaking bisyllables such as mama, baba and dada. Now, pincer grasp a little bit more in detail. Like I mentioned, a mature pincer grasp involves the use of the thumb, whereas an immature pincer grasp is seen at 9 months. At 9 months, a child is also able to play the peekaboo game, where trying to play hide and seek from his or her mother or other caregiver. By the 12th month of age, the child is able to stand without support, is able to walk alone, but does fall in the process. It's because of this milestone, there is a common saying, nobody is able to walk without falling and getting up. So coming back to the topic, mature pincer grasp is also formed by 1 year, and the child is able to play a simple ball game and speak 1 to 2 words with meaning. By 18th month, the child is able to run around, explore drawers, and even explore the plug sockets which are within the house. And domestic mimicry is commonly seen by 18th month. Now, as you can see in this image, the child is having a broom and is attempting to imitate the household task of sweeping, which the child probably saw his or her mother doing. By 2 years of age, the child is able to walk up and down the stairs with 2 feet per step, with a tower of 6 blocks formed, and also draws the attention of others to show the toys, and is able to speak in short sentences of 2 to 3 words. At 3 years, like I said, 3 for try. So the child is able to ride a tricycle, walking up and down with 1 foot per alternate steps, and a tower of 9 blocks, copying a circle, and is able to tell his or her name and gender. You can see in this image, the 3-year-old is able to draw a complete circle, and the other social milestone is proud to show his or her work to his or her mother. At 4th year, the child is able to hop on 1 foot, as you can see, the middle child in the image, and is also able to copy across and play in a small and cooperative group, as you can see in the picture, and is also able to say a poem with sing. Another image of the child hopping on 1 foot, and a fine motor milestone attained by this 4.5 years is able to draw a rectangle and copy across as well. By the 5th year, the child is able to play the skipping game and is able to copy a triangle. Social milestone involved is the ability to dress or undress and ask the meaning of words. And I didn't mention it in the table earlier, but by 5th year of age, the child is able to identify at least 4 colors. Now, coming to developmental evaluation, it's important to take a detailed history from the child in this. We must ask for certain risk factors which affect development, like poor socioeconomic status, poor care by the mother, known family history, any syndromes or difficulties during the pregnancy or during the delivery process, any postnatal difficulties which were there. And it is important to ask about the attainment of milestones. And this is important to distinguish between delay and regression. Now, the term delay is the milestone is not yet attained as expected for the age, and regression is the loss of a milestone which is already attained. Now, it is also important to know whether the developmental age of the child matches the chronological age. Now, coming to the examination of the child, physical examination is required to see the child from head to toe. Also to assess the physical growth and head circumference, to also screen for vision and hearing, as well as neurological examination, and to examine for the primitive reflexes as well. To conduct this evaluation, we need a certain set of kit to conduct a detailed assessment. Namely, we need a ring which is tied to a string to assess for the bidextrous grasp, 9 cubes to see about how many cubes a child is able to play with and how well he is able to stack it up. Paper pellet spoon, a cup with a handle to assess for the grasp, a book with thick pages to check for the ability of the child to turn, a picture book to see what the child is able to identify, along with a red pencil and paper for the child to scribble. Apart from this, other tools required include a list of the milestones as such, as well as a doll or even a mirror to assess. Anything can be used for a developmental assessment, but this checklist of 10 is just a rough guide. So before going for a developmental assessment in detail, we should know that the child should not be hungry or tired and should be in a playful mood with the presence of the mother around. Before engaging into a developmental assessment, adequate time should be taken to make the baby comfortable. It is not like this presentation where I directly started with the slides what was available. We must take time to play with the child to make the child comfortable before assessing the development, because this consciousness or an uncomfortable child will not give the correct picture. More so, we do observe for alertness, concentration and skills of the baby as a continuous process, and observing the child itself will give a lot of information to us. Now, the concept of developmental quotient is to compare the developmental age of the child with the chronological age. Developmental age divided by chronological age into 100 is the developmental quotient. We should assess this in each of the subheadings of gross motor, fine motor, social and language separately, and it should not be done collectively. It should rather be checked under each of the individual headings. Now, there was a range as far as all these milestones were concerned, but there is a point at which we can no longer wait, and at that point where we have to tell that the child is developmentally abnormal. Most of the parents who do come do want to hear that their child is normal and don't want to even consider the fact that there could be a developmental abnormality in their child. As much as we do like to tell them that their child is brilliant and their child is growing adequately, if there is a red flag, they are okay to sometimes hear the concept of wait and watch, where the child could attain the milestone subsequently. But there is a point beyond which we do need to say the milestones are not attained and it requires other detailed assessment. To just name the red flags: visual fixation not occurring by 2 months, lack of vocalization of monosyllables by 6 months, unable to sit without support by 10 months, unable to stand without support by 1 year, unable to crawl by 14 months, unable to stand independently by 17 months, unable to walk independently by 18 months, inability to speak a single word by 18 months, and inability to have imaginative games by 3 years. All of these are red flag signs, and the most important developmental disorder what we should consider is cerebral palsy. Early handedness and inability of attaining early milestones is a marker of cerebral palsy. There are certain other conditions like ADHD, autism, and other syndromes such as Down syndrome where there will be developmental delays. Certain conditions might have developmental regression where the milestone was attained and subsequently lost. But cerebral palsy remains the earliest condition where development is affected. Now, coming to developmental screening, developmental screening is just a brief assessment procedure to see whether the child requires a more detailed assessment or not. Some of these screening tools include the Baroda screening test, Denver Development Screening Test, Trivandrum test, and Good Enough to Draw a Man test. Now, the Trivandrum scale basically shows the age, and at the same time, I'm marking the age here, and at the same time different milestones. So if a social smile is obtained by the second month, it is marked here. It falls within that normal range for that, so the child is normal. Subsequently, if the child begins to roll from his back to the stomach by say 12 months, marking 12 months will come out of the scope of that, so it is developmentally abnormal. So the essence of what I'm trying to say is, if the milestone falls within the blue scope, then it means that the child is normal for the age. If the child milestone comes slightly out of reach, say example 4th month instead of 3rd month, you still need to do a detailed assessment, but it's not so severe as something which falls totally out of sync. Now, Denver Development Screening tool is similar, but does follow a lot more parameters. You do have the age and also typical response which is expected, compliance, interest in surroundings, fearfulness and attention span. And it is a Denver tool assesses all of the 4 headings independently upon a different scale, as you can see in this chart. Now, Good Enough to Draw a Man test is administered for slightly elder children, wherein each of the following points are checked to see whether the child is able to draw head, able to draw legs, able to draw arms, whether the child is able to understand that there's a trunk, the trunk is larger than the breech, the arms and legs are attached to the body, whether there is a neck, whether there are eyes, nose, mouth, hair and ears, etc. Now, if you count each of these, there are 13 components. So, the mental age is considered to be how many points is there plus 13 divided by 4. So if you can actually consider the scoring chart for this, this will get a 3, and that is why the 3 has been put up in the sample. Now, there is also high-risk clinic at majority of the hospitals which requires screening. The screening should be done for at least the children with perinatal risk factors or with red flag signs, if not for everybody, and screening is to be done at periodic intervals. Now, I'm stressing upon this word at least because it is better to have developmental screening for all children routinely. Moving on to developmental screening as such, like I said, it is important to have screening for every child. Every child is entitled to a developmental screening, and it is always better to pick up developmental disorders early on. There was an IAP webinar last week conducted by Dr. Leena Deshpande ma'am, who is a developmental pediatrician from Navi Mumbai. She has developed a very effective tool wherein milestones are correlated with the immunization chart. So a healthy normal child is brought for immunization routinely to the pediatrician, and at that time, if we search for these select milestones at appropriate age, that itself acts as a screening. Now, in our undergraduate and postgraduate days, we do continue to assess development routinely, but there are also certain things what we do tend to miss out, which is where Madam's chart comes into very effective help. I thank ma'am for responding to the email to share the chart for the collective use of everyone. Now, if you just do see the chart in detail, by 6 weeks, there is partial neck head holding, hands are open, social smile is there, and the child responds to sound and coos. If you check for all of these when the child comes for the 6 weeks immunization, it is effective. Similarly, by 14th week, there is head holding, a bit of weight on the forearms, ability to reach out for objects, and responding to sound. Moving on, at 9th month, the child will definitely come for the measles and rubella in government, or measles, mumps and rubella in the private sector setup. So at that time, you check for whether the child is able to sit without support, and whether there is assisted pincer grasp, and whether the child responds to name and plays peekaboo. Similarly, in elder child, by the time we come to 4 to 6 years, we ask for behavioral concerns and schooling, and whether the child is able to tolerate the school well. And of course, as we approach 10 years and the adolescent age group, check for academic progress, behavioral concern, and other adolescent parameters. Before concluding, I would like to stress once more upon the developmental screening. From a practitioner perspective and from a healthcare perspective, I request all practitioners to maintain this. I request all medical students to be aware of this and the concept of developmental screening, and to take this message forward to their families. And to the general public, I request everyone to be open to the idea of screening, because certain disorders, if picked up early, are treatable, and the long-term prognosis is much, much better compared to if picked up later on. I also thank the Indian Academy of Pediatricians for making these slides available and for organizing many nice programs and webinars which help in sharing this knowledge for everyone. I also appeal to all parents to visit their pediatrician regularly for developmental screening, and apart from that, for any issues what they might have with their child, because a pediatrician always does consider the child's interest as superior, and almost all pediatricians see children as their own child and do take good quality care in that aspect. I thank you one and all for listening to this presentation, and hope you tune into the next one. Thank you.